Hi everyone, my name is Nicole Benavides, and today's topic is disorder of fluids and electrolytes, an integral view of potassium homeostasis. Definition. Potassium, the plasma potassium level is normally maintained within narrow limits, 3.5 to 5.0 millimole per liter, by multiple mechanisms that collectively make up potassium homeostasis, such as strict regulation, is essential for broad homeostasis. Such a strict regulation is essential for a broad array of vital physiological processes, including the resting of cellular membrane potential and the propagation of action potential in neuronal, muscular, and cardiac tissue, along with hormone secretion and action in vascular tone. Potassium homeostasis. Potassium homeostasis denotes the maintenance of total body potassium content and plasma potassium level within narrow limits in the face of potential wide variations in dietary potassium intake. It involves two current processes, external and internal. External potassium homeostasis regulates renal potassium secretion to balance potassium intakes minus extrarenal potassium loss and correction for any potassium deficit. Internal potassium regulation controls the asymmetric distribution of total body potassium, with greater part intracellular and only a small fraction extracellular. Here is a video.
Let's start with some basic facts about potassium. Potassium belongs to the family of alkali metals, which includes lithium, sodium, potassium, rubidium, cesium, and francium. Now, lithium, rubidium, cesium, and francium are not found in the body, or they're found in only trace amounts, and they have no known physiological role. However, lithium is often used to treat bipolar disorder. On the other hand, sodium and potassium are the two most abundant extracellular and intracellular ions, respectively. For example, the typical extracellular sodium concentration is 140 milliequivalents per liter, while the intracellular sodium concentration is about 12 milliequivalents per liter. On the other hand, intracellular potassium concentration is about 150 milliequivalents per liter, while the extracellular potassium concentration ranges between 3.5 to 5.5 milliequivalents per liter. All right, now that we know that, let's ask this question. How are these concentration differences between the intracellular and extracellular compartments established for sodium and potassium ions? Well, the concentration differences are established by the sodium-potassium ATPase. Now, the sodium-potassium ATPase transports 3 sodium ions from the intracellular fluid compartment to the extracellular fluid compartment in exchange for 2 potassium ions. Also, these concentration differences play a central role in establishing the resting membrane potential. For example, an intracellular and extracellular potassium concentration of 150 and 3.5 milliequivalents per liter yields an equilibrium potential of minus 95 millivolts, while an intracellular and extracellular sodium concentration of 12 and 140 milliequivalents per liter, respectively, yields an equilibrium potential of plus 60 millivolts for sodium. However, because the cell membrane is mostly permeable to potassium, as denoted by the presence of this potassium ion channel, the resting membrane potential for most cells is approximately minus 70 millivolts, which is closer to the potassium equilibrium potential. Now, because the cell is mostly permeable to potassium ions, it means that changes in intracellular and extracellular potassium ion concentration will have a more profound effect on the resting membrane potential than changes in the intracellular and extracellular sodium ion concentration. For example,
Application in medicine. Aberrant potassium homeostasis. The concurrent activities of external and internal systems act to maintain the plasma potassium level within narrow limits. However, in clinical practice, clinicians often encounter deviations from normal levels when potassium intake is greatly altered. Hypokalemia and hyperkalemia frequently occurs as a result of non-homeostatic processes that are not regulated by changes in potassium balance. These processes increase or decrease potassium excretions, but not in response to changes in potassium intake. For example, action of diuretics, alteration in acid-bases balance, or impair of kidney function, or limit the capacity of kidney to compensate. For example, the chronic kidney disease. Here's two videos about that.
Today we're wrapping up hyperkalemia. Hyper meaning high, cal meaning potassium, emia in the blood, so potassium over 5.0 in the blood. Now, potassium's main function is to maintain heart and muscle contraction through keeping each muscle cell charged or polarized via this sodium-potassium pump. Now, potassium is regulated by kidneys, which I call the washing machines of the body, because they filter the blood and get rid of excess substances, and in this case, potassium. Potassium's influenced by aldosterone hormone I call aldosterone, the security bouncer to the most exclusive nightclub in your body, Club RAS, the renin-angiotensin-aldosterone system in the kidneys. It's a super funny story I cover in our full course here at simplenursing.com. Main causes that keep high potassium in the body and not in the body. So M stands for medications like ACE inhibitors, drugs that end in pril for hypertension or high blood pressure patients. Spironolactone is our potassium-sparing diuretic that keeps potassium in the body. And NSAIDs like ibuprofen are non-steroidal anti-inflammatory drugs, increase potassium or basically keep it in the body. Acidosis causes a disruption in potassium balance, mainly because sodium-potassium pump, which keeps our acid and base in balance, is being overworked. Cellular destruction like burns or trauma. Now, when cells burst, called lysis, potassium inside that cell explodes into the bloodstream, increasing potassium in the blood. Hypoaldosteronism, usually seen in Addison's disease, causes a low aldosterone hormone, resulting in high potassium in the body. Increase of potassium intake, usually from IV solutions or medications, not really caused by diet unless the patient is renally impaired. Brings up our next point, nephrons that are broken, kidney failure patients, also called renally impaired or those on dialysis. Their kidney washing machines are broken, so they can't wash out or excrete that potassium out of the body. Lastly, excretion problems, as mentioned before, mostly dialysis patients. So guys, please remember, renally impaired patients usually have chronically hyperkalemia, or basically high potassium in the body. What's going on?
Here's the other video.
Hypokalemia refers to abnormally low levels of potassium in the blood. In normal circumstances, more than 90% of the total body potassium is intracellular. The remaining is in the extracellular fluid and blood plasma. The ratio of intracellular to extracellular potassium is important for generation of action potentials and is essential for normal functions of neurons, skeletal muscles, and cardiac muscles. This is why potassium levels in the blood are strictly regulated within a narrow range between 3.5 and 5 millimoles per liter. As the normal daily dietary intake of potassium varies widely and can be as much as 100 millimoles a day, the body must quickly and precisely react to keep blood potassium levels within the normal limits. This is achieved by two mechanisms: excretion of potassium through the kidneys and intestines, with the kidneys playing a predominant role; shifting of potassium from the extracellular fluid into the cells by the sodium-potassium pump. The pump is mainly regulated by hormones such as insulin and catecholamines. Hypokalemia is defined as a serum potassium concentration lower than 3.5 millimoles per liter. Hypokalemia may result from increased excretion, inadequate intake, or shift of potassium from the extracellular fluid into the cells. Poor intake or intracellular shift alone rarely causes the disease, but may be a contributing factor. Most commonly, hypokalemia is caused by excessive loss of potassium in the urine, from the GI tract or skin. The cause is usually apparent by the patient's history of predisposing diseases or medication. Urine potassium levels are measured to differentiate between renal and non-renal causes. Depending on the level of severity, symptoms may include muscle weakness, cramping, tremor, intestinal obstruction, hypotension, respiratory depression, and abnormal heart rhythms.
Now, pros and cons. Pros. This kind of disease is easily treated by administration of electrolyte. And the cons, potassium levels are so controlled that just a little change could cause severe problems in the cardiovascular, kidney, and nervous system. And here's another video about that.
Hi guys, Zach here. Today we're talking about hyperkalemia. Hyperkalemia, or high potassium levels, can be hazardous, and as a result, it's an electrolyte abnormality that all medical students and junior doctors should understand. In this video, we'll be covering where potassium is found in the human body, why having too much of it is dangerous, and what causes it to shoot up in the first place. We'll cover treatment of hyperkalemia in video number 2. Let's start with the basics. Remember that potassium is found in the body as K+ cations in solution. So when we talk about potassium, we need to think about where fluid is found in the body and how much potassium you'd find dissolved there. We tend to think about body fluid being split into 2 compartments: the extracellular and the intracellular, fluid inside cells and fluid outside of cells. The extracellular compartment can be further divided into intravascular fluid, the fluid within your blood vessels, your blood serum essentially, and the interstitial fluid, the fluid in your tissues that surrounds your cells. Those among you who speak ancient Greek, not you, will know that the "eme" in hyperkalemia refers to the blood. When we speak of hyperkalemia, we are talking about high intravascular potassium in your blood serum, rather than high total body potassium, which will be more difficult to measure. As levels are broadly similar across the extracellular compartment, we can assume that serum potassium reflects extracellular potassium. If you've got too much in your bloodstream, you've also got too much surrounding your cells in the interstitium. But why is this important? Why is having too much potassium around your cells dangerous?
Here comes the science bit.
Remember that unlike sodium, potassium is a predominantly intracellular cation. While the normal range of serum potassium is 3.5 to 5.5 milliequivalents per litre, the normal intracellular potassium is more like 150 milliequivalents per litre. The balance between intracellular and extracellular electrolytes is critical to cell function. If there's way more potassium surrounding the cell than there's supposed to be, the cell's function will be impacted. Now, I don't want to get too bogged down in resting or action potentials today, as they're beyond the scope of what we need. For now, it's enough to remember that too much extracellular potassium makes cells more excitable. This can be dangerous, particularly in the heart muscle, the myocardium. You see, you want your heart muscle cells to behave themselves and contract in an orderly fashion. If hyperkalemia gets these troublemakers too excited, it causes dangerous irregular heart rhythms, arrhythmias. In extremis, hyperkalemia can stop the heart altogether. Because of the effect it has on these cardiac myocytes, hyperkalemia causes a characteristic ECG abnormality.
Now, issue applied in Ecuador. In the literature, the incidence of hypokalemia in hospitalized patients can reach up to 20%. The hypokalemia is the second most frequent disorder with prevalence of 1.9% and an incidence of 1.4%, considering values less than or equal to 2.8 milliequivalents per liter. Here's the last video.
Dextrose. Now we look at potassium. Potassium is most concentrated inside the cells. It regulates muscle tissue contractility, including heart muscle. It helps control cellular metabolism, converts glucose to glucagon for muscle fuel. It's regulated by kidneys, and excess levels are removed by feces and sweat. Serum potassium levels are controlled by sodium-potassium pump, pumps sodium out of the cells and allows potassium back into the cells. Normal levels are 3.5 to 5 milliequivalents per liter. Foods rich in potassium include artichokes, apricots, avocado, banana, beans, chocolate, carrots, cantaloupe, green leafy veggies, mushrooms, melons, nuts, oranges, prunes, potatoes, pumpkins, spinach, and tomatoes. Alright, so hypokalemia, that's a low potassium. Signs and symptoms include muscle weakness, aches, cramping, paresthesias, confusion, fatigue, syncum, hallucinations, low blood pressure, palpitations. Polyuria and uric with low specific gravity. ECG shows U waves or increased QT interval, flat T waves and depressed ST segment.
Now the conclusion. Potassium is an important element in body's homeostasis, and small deviation of this can cause arrhythmias, neurological symptoms, and even serious effects in the renal system. These electrolyte disorders are treatable, although they can cause a great discompensation in the patient in a short period of time. Here is my social media accounts if you want to check it out. So goodbye, everyone. Thank you.